My name is Lindy Kramer and I'm completing a head-to-toe assessment on Sandy here for Presentation College. I have knocked on the door, provided privacy, and washed my hands. I have also introduced myself to Sandy, and I double-checked Sandy's name and date of birth with her wristband. Alright, so Sandy is alert and orientated to person, place, and time. Her mood status is appropriate and pleasant. Her mental status is good. Her hygiene status is clean and well groomed. Her skin color is normal for her race. Her posture is good. And when I watched Sandy walk into the room, her gait was normal and steady. And her ability to hear and speak is intact and normal. Throughout this assessment, I'm going to be looking at Sandy's skin for color, texture, temperature, and turgor. I will also be looking for any lacerations, bruises, or lesions. First, I'm going to inspect Sandy's hair. So looking at Sandy's hair, her hair is thick, evenly distributed, and brown. Next, I'm lightly going to palpate the scalp. No flaking or scaling of the scalp, and there is no redness or open lesions, and there is no sign of balding. Any pain or tenderness when I do this?
No.
Good. And I will also examine the left side of Sandy's head as well. Next I'm going to be examining, Sandy's face. Sandy's face is symmetrical and there is no drooping of the face noted. Also, Sandy's head size is appropriately proportioned when compared to the rest of the size of her body. Next, I'm going to be checking cranial nerve number 7. Sandy, I'm going to give you a few instructions. I just want you to do what I tell you to do. Okay? Can I have you close your eyes tightly for me? Good. And raise your eyebrows. Good. Smile. And frown. And puff out your cheeks. Good. And next I'm going to be lightly palpating Sandy's temporal artery. So if I can have you remove your glasses for me. Thank you. Temporal artery is smooth and no pulsations felt on exam. Any pain or tenderness?
No.
Here? Okay. You can go ahead and put your glasses back on.
Oh, that's
Okay. Next I am going to examine Sandy's temporal mandibular joint. Can I have you open up your mouth for me, please? Good. And move your jaw side to side. Good. No popping, grinding, or clicking on exam. Good. Next I am going to be examining Sandy's eyes, including her sclera, conjunctiva, cornea, and iris. Can I have you look at me? Good. Sclera is white and clear. Her iris is round with consistent coloration. Next I'm going to pull up on your eyelid and down, okay? Conjunctiva is pink and clear, and there's no lacerations of the eye or drainage of the eye noted. Good. All right, next I'm going to be checking cranial nerve number 3, 4, and 6. So if I can have you just look straight at me, please. Good. Pupils are round, equal, and reactive to light. Next I'm going to be doing a few vision tests on Sandy. So the first one we're going to do is the Snellen chart. So if you want to go ahead and put your glasses back on for me. Wonderful. If I can have you read that bottom line for me. Sorry, I'm nervous.
it's too close. 428-739.
Good. And I would have had patient cover her eye. Sorry. Can we try that again?
The bottom.
Yep, the bottom
that
line.
I can read? I can't
Yep.
read that bottom line.
Okay. Can you read that line for me?
63925.
Good. Can you read the next one at all?
428369. It's getting harder.
That's okay. You did good on that one, so we'll just stick with that one.
Okay.
Now if I can have you cover the left eye, don't worry.
8745. I was doing the line. by
Oh, sorry.
62925.
Again.
63925.
Good. So Sandy has 20/50 vision bilaterally. Next, I'm going to be checking cranial nerve number 2. So this checks the visual field. Sandy, if I can have you cover one eye for me. And let me know when you see my finger in your visual field, okay?
Okay. See? Yes. Yes.
Good. Now cover the left eye for me. And again.
Yes. Yes. Yes.
Good. Next, I'm going to be checking Sandy's extraocular muscle. So what I'm going to have you do is I'm going to have you follow my finger without moving your head. Okay? Good. Next, I'm going to be checking the light reflexes of Sandy's eyes. So if I can go ahead, if you can take off your glasses and come on up. Thank you. All right. Good. And the next eye. Good. Anterior chamber is transparent and iris is flat. Next, I'm going to be examining Sandy's ears. So looking on examination, Sandy's ears are symmetrical. There's no lesions or drainage coming from the ears. And the skin tone of the ear is the same color as the rest of her face. Next, I'm lightly going to palpate your ears and look for the lymph nodes behind your ears, okay? Skin is intact and smooth. Any pain or tenderness? Okay. Next, I'm going to look at the lymph nodes. Any pain?
Nope.
No? No lymph nodes were palpated on an exam, which is a normal finding. Next, I'm going to complete a few hearing tests on Sandy here. The first one is called the whisper test. So Sandy, what I'm going to do is I'm going to whisper a couple words, and I want you to repeat what you hear, okay?
Okay.
Sunrise.
Sunrise. Banana.
Chair.
Chair.
Good. Next, I'm going to be doing what is called the Weber test. So, you can go ahead and put your glasses back on here.
That's good.
Okay. Next, I'm going to put this on top of your head. I want you to know, or I want you to let me know when you can't hear the vibration anymore.
Okay. Okay.
Good. And next, I'm going to be doing the Rini test on Sandy here. So same thing, just let me know when you can't feel the vibration, okay? Or hear the vibration.
Okay.
Good. And again.
Okay.
Good. Air conduction is twice as long as bone conduction, which is a normal finding. Next, I'm going to be looking inside Sandy's ear at her tympanic membrane. Alright. Good. And the next ear, sorry. All right. Tympanic membrane is normal, and there is no bulging of the tympanic membrane noted. All right. Next, I'm going to be examining Sandy's nose. So on exam, Sandy's nose is midline and straight. Skin tone is the same color as the rest of her face. Nostrils are symmetrical, no flaring or narrowing of the nares noted, and there is no nasal drainage. Good. And next I'm going to lightly palpate the maxillary and frontal sinuses. Maxillary sinus rest. Any pain or tenderness?
Nope.
Good. And the frontal sinuses? Any pain or tenderness there?
Nope.
Good. Next I'm going to be looking inside Sandy's nose. All right. is straight, midline, and non-deviated. Her mucosa is moist, and the turbinates are a deep pink color. These are all normal findings of the nose exam. Next, I'm going to check the patency of Sandy's nostrils. So if I can have you cover one nostril for me and sniff, and the other one. Good. Next, I'm going to check cranial nerve number 1. So I'm going to have you smell something while you're closing your eyes, and I want you to let me know what it is.
Okay.
Okay? Go ahead and close your eyes. Can you tell me what you smell?
Stale coffee.
Very good. All right. All right, next I am going to be examining Sandy's mouth and throat. So on exam, Sandy's lips are pink and symmetrical both vertically and laterally. Can I have you open up your mouth for me, please? Good. Teeth are white with smooth edges, no chipping of the teeth or missing teeth noted on exam. Good. All right. Next I am going to check cranial nerve number 9 and 10. You go ahead and say ah for me. Good. Sandy's soft palate rises symmetrically, and her uvula stayed midline. Good. Now I'm going to check cranial nerve number 12. Go ahead and stick out your tongue for me. Good. Tongue is pink and symmetrical, and there are no lesions on the tongue noted on exam. Good. Now I'm going to examine Sandy's neck. On examination, her trachea is midline. Next, I'm going to look at her jugular veins. Good. On this side. Good. Jugular veins are non-distended and not bulging, which is a good sign. All right, next I'm going to lightly palpate your trachea and look for any lymph nodes. Any pain or tenderness with this?
No.
Okay. No lymph nodes felt on examination, and I was not able to palpate the thyroid gland, which is normal. Can I have you go ahead and swallow for me? Good. All right. And next I'm going to locate Sandy's carotid artery. And pulse as well. Good. Strong pulse on both sides. Next I'm going to listen for any carotid bruits. Go ahead and take a deep breath and hold it for me. Good. And again. Good. No swishing sounds heard on exam there, which is a normal finding. Next, I am going to do range of motion of Sandy's neck. So if I can have you just tilt your head forward and back, to the left, and to the right. Good. Go ahead and rotate your neck for me. Good. Next, I'm going to be checking cranial nerve number 11, which is your sternocleidomastoid muscle and your trapezius muscle. So what I'm going to do is I'm going to push down on your shoulders. I want you to push against my hands, okay? Good. Her muscles are intact and good strength. Next, I am going to be examining Sandy's shoulders, arms, elbows, wrists, hands, and fingers. You can go ahead and put your glasses on for the whole rest of the exam.
Okay.
Good. All right. So Sandy's shoulders have an even contour to them. Her arms are symmetrical. There's no edema or swelling, no lesions or bruises noted. Next, I'm going to lightly palpate, okay, your arms and your hands. Good. Skin is intact and normal. Temperature is normal. and Sandy's fingernails have a capillary refill of less than 2 seconds, which is a normal finding. Next, I'm going to locate Sandy's brachial and radial pulse. That's good. Strong pulses on the brachial. Strong pulses on the radial. And I would do the same on the left side of Sandy's arm. Next, I am going to be doing range of motion of Sandy's shoulders, elbows, wrists, hands, and fingers. Okay? So what I want you to do is I want you to raise your hand above your head and bring it through. Good. And on the left side, up and down. Good. Next I'm going to do the elbow. So I'm going to have you put your palm on up for me and bend at the elbow and bend back down for me. And on the right side, bend back down. Rotate those wrists for me. Good. And flex your hands and extend them. And your hands touch each finger to your thumb. Good. Next, I'm going to be examining the strength of Sandy's deltoid muscle, her bicep muscle, her tricep muscle, and the strength of her hands. So, for the deltoid muscle, I'm going to have you put your arms straight out for me, and don't let me push down. Good. The bicep muscle, don't let me push you forward. Good. And the tricep muscle, go ahead and put you, yep, and don't let me push you back. Good. And I would do the same on Sandy's left side. Next, go ahead and squeeze my hands. Good strength there. And try to spread your fingers apart. Good. Sandy has a 5+ muscle strength, which is good. And now I will be checking Sandy's bicep, tricep, and brachial radialis reflexes. So if I can go ahead and lay your arm flat in mine. Good. So the brachial, or the bicep reflex, and the tricep reflex, and then the brachial radialis reflex. Good. And I would do the same on Sandy's left side. Next, I am going to do the neurological system with the hands. So I'm going to place something in your hand, and I want you to tell me what you feel. Okay? Go ahead and close your eyes. Open up your hand for me. Can you tell me what you feel?
A coin.
Very good. Next, I am going to write something on your hand, and I want you to tell me what I wrote or drew.
L.
Very good. And then next, you can open up your eyes. I'm going to explain what I'm going to do.
Okay.
I'm going to softly touch you with something, sharply touch you with something, and a vibrating feel.
Okay.
Let me know what you feel, okay? So go ahead and close your eyes.
Soft. Pointy.
Good.
Vibration.
Good.
Soft. Pointy.
Good. Good. So those are all intact. And next I'm going to check to see if Sandy has carpal tunnel. So what I want you to do is put the dorsal backs of your hands together. And we're going to sit here for a minute. I'm watching you watch. Any numbness? Yeah. Good. Any pain?
Oh.
Working out your arms. 15 more seconds. All right, any numbness, tingling, or pain?
Nope.
Good. Sandy does not have any symptoms of carpal tunnel syndrome. All right, next I'm going to move to Sandy's anterior or posterior chest. So what I'm going to do is I'm going to examine your back and your spinatus process. Sandy's spinatus process is straight and aligned. No curvature of the spine noted. And her back falls and rises with each breath she takes. Next, I am going to be palpating for thoracic expansion. So go ahead and take a deep breath for me. Good. And again. Good. Next, I am going to be checking for tactile phremitis. So I'm going to do a series of 4 palpations down your back. I want you to say 99, okay?
Okay.
I will let you know when to do that. Go ahead.
99, 99,
Go ahead.
99,
And again.
99.
Good. Phremitis is felt bilaterally, which is a good sign. Next, I will be listening for Sandy's breath sounds. Go ahead and take a deep breath for me. And again. And again. 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 And again. Good. Sandy's breath sounds are normal. No wheezes or rhonchi heard on examination. Next, I'm going to lightly palpate your back or percuss your back and listen for any resonance. Okay. Good. And now I will be checking for CVA tenderness, which is costovertebral angle tenderness. So I'm going to lightly tap your back here and let me know if you feel any pain or tenderness, okay?
Okay. Nope. Nope.
No? Good. All right, now I will be examining Sandy's anterior chest. So on exam, Sandy's chest is symmetrical, no lesions or lacerations noted on her chest. And then her chest rises and falls evenly with each breath she takes. And Sandy's chest wall does not have any retractions to it. All right, now I will be listening to your apical pulse for 30 seconds. So pulse is normal rhythm, and pulse, the limit is anywhere from 60 to 100 beats per minute. All right. And next I am going to listen to your aortic valve, your pulmonic valve, Erb's point valve, tricuspid valve, and mitral valve. Okay?
Okay.
This is the aortic valve, pulmonic valve, mitral valve, or Erb's point valve, tricuspid valve, and mitral valve. Good. No murmurs or squishing sounds noted on exam. Next, I will be feeling for axillary lymph nodes. No lymph nodes felt on examination. And now this is where I will explain to Sandy about a breast exam. And the same goes for a male breast exam. So when you do your breast exam, you want to do it once a month in a warm shower around the same time each month. You're gonna lift up one arm, and you're gonna do you can do one of 3 methods on palpating your breast. So the first method is a circular method. You're just gonna go around towards the middle of your nipple. And then the other one is the wedge method. So you're gonna go from the outside in towards the nipple. And then the last one is a vertical swipe. So you're gonna go up and down from one side of the breast to the other. You are looking for any lumps or any changes in your breast. It's important to notify your doctor right away of any changes. Okay, same goes for the male. Now I'm gonna lightly percuss your chest and listen for any resonance. Good. Now I'm gonna be examining Sandy's abdomen. So if I can have you go ahead and lay down. All right, Sandy's abdomen is symmetrical. No lesions or bruises on her skin. All right, and now I'm going to listen for any aortic bruits. No swishing sounds heard on exam there. Next, I'm going to listen to all 4 quadrants of Sandy's abdomen for bowel sounds. Good. Sandy has active bowel sounds in all 4 quadrants. No hypoactive or hyperactive bowel sounds, which is good. Next, I'm going to lightly palpate all 4 quadrants of your abdomen for mass, and I'm looking for any masses or tenderness. Any tenderness or pain?
No.
Good. No masses felt. Next, I'm going to deeply palpate all 4 quadrants, okay, for masses and tenderness. Any pain or tenderness?
No.
Good. That's good. And now I'm going to percuss all 4 quadrants and listen for tone. Okay. Good. Next, I'm going to locate Sandy's femoral pulse. Pulse is strong and normal. And now I'm going to be checking for any vertical or horizontal lymph nodes. No lymph nodes felt on examination. That's good. All right, I'm going to have you sit on that for me, Sandy. And I am going to inspect Sandy's legs, knees, feet, and toes next. So on examination, Sandy's legs are symmetrical. Skin is intact, no bruises, no lesions, and color tone is normal. And there is vascular sufficiency in the legs. Good, next I'm going to lightly palpate your legs, okay? Sorry.
It's okay.
Skin is smooth and intact. Can I have you take off your shoes for me, please?
Sure.
Thank you. Now I can feel your feet. All right. And Sandy has a capillary refill of less than 2 seconds in her toenails as well, which is good. All right. Next, I'm going to be locating Sandy's popliteal pulse, her tibial pulse, and her pedal pulse. Sorry. pulse is strong and normal rhythm on the tibial pulse. Pulse is strong, and the pedal pulse. Good. And next I'm going to be doing range of motion of your hips, your knees, and your feet. Okay? So if I can have you go ahead and stand up. Don't hit your legs. So if I can have you just stretch your leg out and back. Good. I would do the same on the left side. And knee, I want you to bend, back and forward, back. Good. And I would do the same again on the left side. You can go ahead and sit down again for me. Next, the foot, I just want you to rotate your foot and flex it and extend it. Good. So good movement in all of her lower extremities. And now I'm going to be checking for the strength of Sandy's hip muscle, her quadricep, her hamstring, and her foot. So if I can have you go ahead and lay down again for me. All right, so we're going to do the hip muscle first. I want you to raise your leg and don't let me push down. Okay? Good strength there. All right, go ahead and sit on up. All right, and we're going to do the quadricep muscle next. So don't let me push your leg in, okay? Okay. Good. And your hamstring, don't let me push it out. Good. And for your foot, don't let me push up. And don't let me push down. Good. And I would do the same thing on Sandy's left side. Next, I'm going to be checking for Sandy's patellar reflex and her ankle reflex. So the patellar reflex, good, good, ankle reflex, good, and good. All right, and next I am going to be testing the sensation in her legs again. So again, I want you to tell me if you feel soft, smooth, or a vibration feeling, okay?
Okay.
All right.
Soft. Sharp. Sharp. Vibration.
Good. All right. And next I'm going to do the Romberg test on Sandy. So if I can have you go ahead and stand up for me. What I want you to do is close your eyes for 5 seconds. And I stand close to patient in case she starts to sway. All right, can I have you lift one leg up for me? Good, and I would have her do it on the left side as well. Good. All right, you can go ahead and open your eyes. Next, what I want you to do is I want you to walk straight, normally. Good, and turn around and walk heel to toe. Good. So if I can have you go ahead and sit up for me again one last time. And next I'm going to have you do what is called the heel run. Okay? So I want you to take the heel of one of your foot and put it on the other leg and run it down your leg. Good. And do it to the other one. Good. All right. So patients, lower extremities are normal. Next I'm going to check Sandy's spine. So if I can have you go ahead and stand up one last time. Spine is straight. Can I have you bend over and touch your toes for me? Spine is straight, no curvature noted. Good. Go ahead and stand on up and lean to the left for me and lean to the right. Good. Sandy's examination is normal, and that's it.